We really want to provide services in the community that people live. And ultimately, that will help them live more productive lives and be less likely to return to the state hospital or other sort of more intensive treatment options. We're humans, right? Part of our growth is interacting with others and having loving and supportive relationships. And individuals with mental illness have the same needs as everyone else. And having caring individuals around them to help kind of spur them on and be the best individual that they can be is part of what we're striving for, why we want them in their own community so that they can feel supported and that they can see their life goal ahead of them.
We reviewed the communities where patients come from, and we identified a large population coming from Southwest Washington, especially in the Vancouver area. When we made the decision, there was no beds for this 90 to 180 day commitments.
Currently, the state offers adult inpatient psychiatric care in two large hospitals, one in Spokane and one in Lakewood. The vast majority of our population do not live in Lakewood or Spokane. Spokane is a large, Eastern Washington is a large catchment area, and their family members have to come from a long ways away. And unless you live right near the facility, that can be an insurmountable barrier, particularly if you have to rely on public transportation or someone else to give you a ride.
This facility gets us to more of a long-term resource in Clark County. Several inpatient behavioral health facilities throughout the state are already located near schools and operate safely every day. DSHS hosted community meetings before and after site selection. We also engaged in outreach with the Battleground and Vancouver school districts, Washington State University, Vancouver, the Gardner School for Arts and Sciences, and other community organizations. In addition, we developed a project website and responded to letters and phone calls that come in. We also followed what the Clark County's requirements and the City of Vancouver's requirements for outreach, public outreach for these types of projects.
So all of the patients that will be going to the Vancouver facility will have had court-ordered competency-related services, but will have been found to have needed further mental health treatment, and they will be transferred to the state hospital, receive mental health services, get some stabilization, most likely medication, treatment, and then will be triaged as being appropriate for the smaller RTF facility and then transferred to the facility.
We had to come up with a screening tool for this facility to decide who can safely be served in the facility. So we are still planning on serving the hardest or most challenging to serve clients at the state hospitals. So at the end of the day, we will only be serving people in the Clark County facility that can be managed in a 16-bed facility with the staffing levels available within the safety precautions we've built into the building, and patients that have higher needs than that or might be more challenging to serve than that would be served at the state hospital. So we do have that built into our processes as well. If you actually look at all the research, it's quite interesting that people with a serious mental illness are more likely to become a victim of a crime than perpetrate a crime on someone. There is a small amount of the population who, if their mental health condition decompensates to the point where they commit a crime, they do sometimes need an intervention through the criminal justice system, but that system quite quickly recognizes that there's a mental health process at play and tries to handle it through the mental health processes to get the person stable. So the environment we built is very warm and welcoming. We actually have nature nooks where you can see outside and get some peace and quiet and sit in a comfy chair and read a book in some of your downtime. But it's a treatment facility. So we have programming throughout the day, the evening, the weekends. We have different kinds of groups. And so the groups can range from things like learning living skills, like maybe you've been in an inpatient setting for a really long time and you haven't built a budget or grocery shopped. And so we can teach you how to do all of those things. We're going to teach you strategies for managing your mental health symptoms. We are going to do trauma treatments. We're going to have opportunities to talk to your medication providers about what the meds do for you and what symptoms are you having and how is this something long-term, because taking meds long-term is not fun for any of us. So it's something we all have to get our minds around when we need to do that. So they'll have access to the medical providers for those kinds of treatments. And we have exercise and recreation activities, because you can't just sit around bored all day inside a hospital, and recreation is a good part of mental health. So we want to get you engaged in things that give you a sense of meaning and purpose. So then when you get out in the community, you're already going towards those things, and then you can be ready to continue those activities when you get out into back to your home community. When we start getting people ready for the discharge planning process, that's when we're going to start taking a look at, are there any risks left that would necessitate someone be in an inpatient setting, and then they would stay. And if not, we start to build a plan with them that's very thorough, the patient's involved, their families involved if they would like, and we build a plan in the system that mitigates any kind of risks they might have and make sure they have as much mental health treatment, medical treatment, vocational services, housing, all the things that they need to be safe and stable in the community before they're discharged. The more integrated someone is into their community and the more welcome they are in the community, the better their recovery is. So we always want to have as much involvement as we can, getting people involved in any faith-based activities, groups, services, clubs. That's what's going to keep you safe in your community, is knowing people, being active, being engaged, value them for what they bring to the table. And everyone brings great things to the table. So it's a really good opportunity for these local facilities to really help people in their recovery journey. So I was lucky enough to be on the design team from the very beginning for these facilities. And so we had safety in mind throughout the entire design process. The patients won't be leaving the facility other than to go to medical appointments or possibly like looking for discharge placements that are staffed, secured visits in the community. But the remainder of the time, they're locked in the facility. We have fenced in, gated outdoor areas. We have a combination of key cards and electric locks. And so there's many processes within the structure of the facility to keep everyone where they're at. And the idea of this is involuntary inpatient, so that it's an inpatient locked hospital.
DSHS conducted a thorough assessment of environmental impacts through the State Environmental Policy Act process and found that no significant environmental impacts are expected. All of the SEPA documents can be found online. So the property that we have cited, that we've purchased, is zoned appropriately for this facility. It's zoned as a business park. There are 3 wetlands on the property, one of which we're retaining, which is the only significant wetland on the property. The other 2, we are purchasing what they call wetland credits from a kind of a bank. So we're actually preserving more wetland capacity by buying into the bank versus what we have on site today. Community members can contact us directly at BHA RTF siting, that's SITING, at dshs.wa.gov. They can also join the Hear and Examiner meeting held by Clark County. Once scheduled, we will add the information to our website. We're hopeful that folks understand the realness and the importance of these types of facilities and the opportunity to shape how we provide treatment to individuals that just need help, and get them back on their feet, and hopefully be productive citizens, just like all of us are today.